All right, we are about to go on a pretty incredible journey. Not to some distant galaxy, but deep, deep inside one of the most amazing factories here on Earth, the human liver. At the microscopic level, every single cell tells a story. And today, we're going to see what happens when that story takes a really dark turn.
So what you're looking at here, it isn't some piece of abstract art. It's a high-resolution snapshot of liver cells. And those giant white circles, yeah, they are not supposed to be there. That right there, that's chapter 1 in the story of an organ in distress. By the time we're done here, you'll know exactly how to read these signs. And this really gets to the heart of it, doesn't it? The liver has something like 500 essential jobs, from filtering out toxins to helping us digest our food. But it's often called the silent organ, because it almost never complains until the damage is already severe. So what does trouble actually look like from the inside? Well, let's dive in and find out.
Our story, well, it pretty much always begins in the same place. It starts off quietly, with a simple substance that's, essential for life, but can become a huge problem when you have too much of it. It all starts with fat. The fancy medical term for this is steatosis, and all it means is the abnormal buildup of fat inside the liver's main worker cells, which are called hepatocytes. I want you to think of the liver as this super high-tech processing factory. Steatosis is like junk just piling up on the factory floor. It's not supposed to be there, and it's starting to get in the way of everything. Okay, and this is where it gets really interesting, because not all fat buildup looks the same. On the left, you've got macrovesicular steatosis. See how that one giant fat droplet literally shoves the cell's command center, the nucleus, off to the side? It's a sign the liver is just struggling to process and ship out all the fat. But on the right, it's a bit more sinister. In microvesicular steatosis, you see lots of these tiny little droplets. And that's a huge red flag that there's damage to the cell's power plants, the mitochondria. And when the power goes out in a liver cell, well, that's a much more direct path to serious problems. And yeah, the amount of junk on that factory floor really matters. Pathologists, they don't just see the fat, they actually measure it. And when that fat buildup, that steatosis, is in more than 2/3 of the liver cells, well, it crosses this critical line and gets officially classified as severe. This table shows you exactly how the experts grade the problem. You see less than 5% fat, totally normal. But from there, it's this sliding scale from mild all the way to severe. And this grading is so important. It's not just some score, it's a direct measure of risk, and it helps doctors figure out just how aggressive they need to be to fix things. So far, we've just been talking about storage, about clutter. But what happens when the liver just decides it's had enough? This is the big turning point in our story. The simple presence of fat can trigger a much more aggressive, much more dangerous response from the body. The problem is about to escalate from just clutter to a full-blown crisis. And this crisis has a name, steatohepatitis. Let's break that down real quick. Steato means fat, right? We got that. But itis, anytime you see that in medicine, it means one thing, inflammation. So this is the stage where the body sends in its immune cells to deal with those fatty, stressed-out liver cells. It is literally a fire breaking out on the factory floor. And the most important thing to know is that this fire, this inflammation, causes active damage and leads to scarring way faster. So what starts this fire? Well, there are two main culprits. On the one hand, we have alcohol, which is a direct poison to liver cells and triggers inflammation. On the other hand, we have a whole group of conditions we call metabolic syndrome, things like obesity, type 2 diabetes. That leads to non-alcoholic steatohepatitis, or NASH. The key here is that two totally different triggers can light the exact same fuse, leading to the same 5-alarm fire inside the liver. And this is just wild. Even with those different causes, when a pathologist looks through a microscope, the battlefield can look almost identical. It's like the liver only has a few ways to show that it's been injured. So it doesn't matter if the attack comes from alcohol or from metabolic issues, the inflammation, the cells ballooning up and dying, it's the same exact pattern of destruction. Any prolonged battle is going to leave scars. And as that fire of inflammation just keeps raging on, the liver's repair crews rush in. But in their hurry to patch up the damage, they end up creating a new and honestly, a much more permanent problem. Check this out. This image has been specially stained to make scar tissue pop out in this bright blue color. This scarring is called fibrosis. So instead of carefully rebuilding the factory just like it was, the repair crew is just laying down these shoddy concrete patches. This scar tissue, it doesn't do anything a normal liver cell does. It's just filler, And as it builds up, it literally starts to choke the life out of the organ.
And this scarring, it happens in these predictable stages. First, it starts small, forming around individual cells. That's pericellular fibrosis. Then, those little individual scars start to link up, forming these bridges between different parts of the liver. And finally, you get to the end game, cirrhosis. That's where the beautiful, organized architecture of the liver is just completely destroyed and replaced by this tangled mass of scar tissue.
And here is the ultimate and most tragic irony. By the time the liver gets to full-blown cirrhosis, the fat, the very thing that started this whole firestorm, might be completely gone. Why? Because the liver cells that were holding it have been killed off and replaced by that scar tissue. The original evidence has been consumed by the consequences. Now, we've focused a lot on the story that starts with fat, mostly because it's just the most common one we see. But it is so important to remember that the liver can be attacked by other invaders too. The big takeaway here is that the liver's response system, inflammation followed by scarring, is basically its standard defense protocol. It doesn't really matter if the first punch comes from fat, or a virus, or something else entirely. As we're about to see, many different roads all lead to the same damage destination, cirrhosis.
So, for example, take chronic viral hepatitis C. Here, the invader is a virus. It sets up camp inside the liver cells, and the body's immune system just launches this relentless attack. You can see all those little purple immune cells cluster together, waging this long-term war. And the collateral damage from that war? You guessed it, inflammation and eventually the same fibrotic scarring.
Or what about autoimmune hepatitis? This is a really tough one. It's a tragic case of mistaken identity, where the body's own defense force starts attacking its own liver cells. It's basically friendly fire on a microscopic scale. But for the liver, the result is exactly the same as any other attack: chronic inflammation, dying cells, and that inevitable buildup of scar tissue.
So we've traveled all the way from the first subtle signs of fat piling up to the final hardened landscape of cirrhosis. We've seen that the liver, this silent and tireless worker, keeps a super detailed record of our health right there in its very cells. Its microscopic story is our story. So the question this leaves us with is this: knowing what those early chapters of damage look like, what can we change in our own story to make sure we write a healthier ending for this vital organ?